Okay. All right, guys, I think we can start. I'll be letting in delegates as we go through the session today. Welcome to Connect to the Chamber. We are part of the Border-Kei Chamber here in East London, and we have two really exceptional ladies on board today, Trish Ryan from Think Business Solutions, as well as Kim Dillon from Pinkart and Associates. So we do really welcome the two of you. We have nothing but top expectations from our chat today, and we encourage everybody to get involved into the conversation. So over to you, Trish, and to Kim. Let's see what you are all about today.
So today we'd like to help you to ensure that both your customers and your employees are COVID-19 safe. And we ask that if you have any questions, that you please just make a note of them and email them to Trish at the end of the presentation. Okay, so Trish, what needs to be in place for your COVID-ready workplace plan?
Okay, morning everybody. The most important thing in your plan is that you must appoint a compliance officer. I find a lot of people are getting their plans ready, but they're forgetting to appoint the compliance officer. Another thing that's important is you need to have an isolation zone. In other words, if somebody tests positive in the workplace during work hours, you need to isolate them to a room so that you can make sure that your employees and your customers are safe. So a lot of the time they forget about the isolation zone and the compliance officer. Another important factor, Kim, is you need to obviously identify your vulnerable employees and your vulnerable customers. So if you have some that are over the age of 60 or they have some chronic condition that you need to be extra cautious about, you need to educate those employees to either, isolate and work from home if possible, or you have to look for an alternative for them. Because at the end of the day, you have to protect the safety of those vulnerable employees and the customers.
And with specific reference to the personal care industry that's just been allowed to come back to work, what basic principles apply to them?
Okay, what happened is the government actually implemented a new directive for the personal care industry. And the gist of it is that you have to obviously, like in most workplaces, you've got to have your hand washing, your social distancing. You have to make sure that you wear the masks and that. And I think with the personal care, one of the things that came up, for example, for a hairdresser, is you need to have fresh, clean towels for each customer. You have to sanitize the workplace to make sure that the next customer is safe. Because at the end of the day, we're saving lives.
Okay. And at this, when somebody enters into your building, what should be included in that screening questionnaire?
One of the most important ones is to ask the person if they've been exposed to somebody who has tested positive in the past 7 days, or because you need to make sure that you protect your workers, and obviously then also pick up the symptom screening, which we can say where you check if they've got a headache, if they've lost their sense of smell, if they've got a dry cough, if they're tired. There's a lot of symptom screening information that you need to have in your attendance register.
And should you keep a register for customers as well?
Absolutely. In fact, with the personal care industry, they've actually asked them to get their customers to sign an indemnity. And I'm stressing here, you need to bring to your customers' attention that they indemnify the hairdresser for the said appointment, because they are exposing themselves to close contact with the hairdresser. So they need to be aware of the dangers with regard to COVID. So they need to have that indemnity in place.
What should be done if a person fails the COVID-19 screen test?
Okay, if this happens just before they come into the workplace, whether it be a customer or an employee, you need to put them into that isolation room that I mentioned. Mm-hmm. And you need to allow them to have access to a telephone, or they use their own cell phone to phone a healthcare practitioner so that they can get guidance of how to deal with the situation.
Okay, and if it's an emergency?
If it's an emergency, there is a hotline number, which is 0800 2 999, and that needs to be displayed in the workplace on a poster. Everybody must know who's your compliance officer, what is your hotline emergency number.
Are there areas in the businesses which are considered to be higher risk areas?
Yes. Okay. So you also need to do a risk assessment, and that will be the entrance to the workplace. We all know that is the most high risk area, the entrance and the exit to the workplace. It's actually quite cute because some of the schools, they've actually had like demarcations, special demarcations made, say for little girls, and they would have this special little painting of not just using the tape or the masking tape. They have little pictures painted onto the social distancing 1.5 meters, which is very cute because, you know, it's difficult for us all, but try and make it fun.
Yeah, and with these high-risk areas and with the workplace being a risky area, are there measures that can be put in place to try and mitigate the risks?
Well, yes, obviously you have to make sure that you have the social distancing, you make sure you wear the masks. And I think what's very important is the new directive that came out on the 12th of July from the President, the National Disaster Directive. It actually stated that if, for example, they do a random check in your workplace and some of your workers are not practicing social distancing, they're not wearing the masks, it's the CEO of that company that will be fined for that. So you need to educate and you need to train your staff so they know what's in your COVID policy, what they need to do and what they don't need to do. And, you know, you need to get an attendance register signed that you went through the policy with them to prove that you have educated them.
And also another example would be possibly to keep the windows open instead of using air cons.
Good call, because air cons are a high risk because of the circulation of the air and COVID. So you need to make sure the ventilation is free flowing, as well as in your isolation room, guys. You need to make sure that you have a window that you can open in that room. And you need to also make sure there's maybe a separate toilet that that particular person can use. What happens if they test positive and they need to actually go to the loo? You need to make sure that you have a set toilet for that particular person to use. I know it's funny that I'm talking about this, but it's things we have to be aware of.
And what should be put in place with regard to the hygiene and the cleaning of the workplace?
Okay, the fun part when I visit the schools and that, which is interesting, is that the teachers are actually taking the jobs to make sure they clean down the sports equipment, they clean down the training aids that they use for teaching, wipe down the desks. So everybody's putting together and making sure they desanitize and there's frequent cleaning, not just of the door handles and the desks, but if there's a public place like a tea room or whatever, which most of us encourage you not to use, it must be cleaned on a regular basis.
Okay. And how do you reduce physical contact or implement social distancing at work?
Okay, like for example, the hairdressers, they will make sure that they set appointments for their clients and they will stick to those appointments to make sure nobody's waiting outside. The same with your employees, you must stagger your lunch breaks. Stagger the tea breaks if they are applicable in the workplace, just to make sure that there's a social distancing. The desks must be 1.5 meters apart from the other person's desk and isolate where you can.
Okay. And specifically, what PPE is needed to protect the employees and the customers?
Okay, it's compulsory for the employees that each employer provides them with 2 cloth masks. With the hairdressing care, now I keep on talking about the hairdressing, I'm just trying to make it a bit fun. They actually have a face shield that they have to use, and they have to make sure that there's a sanitizing bottle for each member of staff. And the same obviously for when the customers come in, nobody's allowed into the building without their own mask. And they will sanitize at the entrance to the appointment.
With regard to employees who are socializing in their personal time, are there any implications for them if they bring COVID-19 back to their workplace?
Yes, it was actually quite fun. There was a lovely video that came from a fellow colleague of mine, Johnny Goldberg, where he was interviewed on ENCA, and he was, explaining that you have to be very cautious if you are going to socialize and break or breach the COVID rules, and you then expose your workplace to this situation. You could be follow disciplinary procedures based on that, depending on the facts that the company has. So it all depends on the facts of the particular case. But if you put it on social media, it's out there in the domain for everybody to see. So you're not practicing or saving, the lives of your fellow or co-workers by doing things like that.
Yeah. And if you're absent from your workplace with no medical proof or evidence of testing, what happens?
Okay, that's difficult because if somebody decides voluntary to self-isolate, then no work, no pay would apply. Mm-hmm. If, for example, they go for a test and they haven't got the results yet, the law is that you must self-isolate. Now, it's just changed recently. I haven't seen the directive. It hasn't actually been implemented. But the health minister said that the self-isolation period has moved from 14 days to 10 days now. So it's very important for that person to isolate. If they then get the result that they are positive, you can then obviously allocate that leave to sick leave. Okay, so the first option is to standard sick leave policies need to apply.
Okay. And if you contract COVID-19 outside of the workplace, is it still considered as sick leave?
Yes, so you need to get the evidence. Obviously not in this situation like Johnny Goldberg told us about making sure we're not negligent and socialize and get the virus from a third party. If you're not to blame and you just go shopping and you get the virus and you don't even know where you got it, provided you can prove that it's sick leave. So you will go to the doctor to get a sick note and then it'll be classified as sick leave. If your sick leave is exhausted, there is a special COVID UIF illness benefit that you can benefit from.
Okay. And if you contract COVID-19 during the course of your employment, what happens then?
Okay. That is where, if you can prove it was during your course and scope of your employment, obviously for the nurses, they will be able to claim because they can prove that, they've been working in the hospitals and there's a high risk for them. They can claim from workmen's compensation for the sick leave.
And after you've had your 10 days mandatory self-isolation, what are the procedures for coming back to work?
Good question. You need to actually be medically evaluated by a doctor, and they must tell you whether you're fit to return to work that you can provide to your workplace. And then obviously the workplace will do symptom screening, make sure that, in order to make sure the other employees are safe, they will ask you the screening questions, check your temperature, and ensure that, there's safety in the workplace. Because at the end of the day, your health and safety in the workplace, that comes into play.
Yeah. And in the situation where an employer has to close down their offices to either deep clean and employees aren't able to work from home, how do you treat that lost time?
Okay, that is a tricky one. I've been in businesses where they've actually accommodated. Okay, so first you have to disinfect and clean the workplace, okay? And then you've got to assess if it's a high risk or a low risk if they return to work, okay? So if someone's a high risk and they have a chronic illness and they're asthmatic, for example, you are going to make sure that they can work from home if possible. If they can't, you can try and claim this quarantine illness benefit from UIF for them. If there's negligence that comes into play and you have caused the negligence by socializing and bringing the COVID test positive to the workplace, then obviously no work, no pay would apply.
Okay. And could you catch up that time maybe on a Saturday or a Sunday?
Correct. A lot of the companies are saying that they are able to work back the time that they've lost. So say, for example, you find out the person gets it at 12 o'clock, you find out. You allow the employees to go home, and for those few hours that they couldn't come back in the afternoon, those hours can be worked back if possible, if they're unable to work from home. So you have to be flexible and accommodate them, to make sure that everybody's interests are taken into account.
Okay. And when is it necessary for an employee to go for a COVID-19 test?
You can't force them to go for a test, okay? If they fail all the symptoms, we will obviously, the compliance officer, together with management and together with a health practitioner, on the advice of a health practitioner, they will decide whether the person needs to go for a test or not.
Okay. And who pays for this test?
Okay, the test is normally paid by your medical aid. I have seen some medical aids that say you can't even go for the test until you show all the symptoms. Some people don't even show the symptoms and test positive, so it's a bit of a tricky one. But if your medical aid is able to pay for it, that's fine. What other companies have done is they've actually loaned the money to the employer and allowed them to pay it back if they don't have the means to pay for the test. Okay. Obviously, if you're negligent and you socialize and you don't wear a mask and you cause the eruption in the workplace, then you're going to have to pay for that out of your own pocket. But the normal basic conditions will apply, where they'll sign a salary to a consent to a salary deduction of, like, say, 25% or whatever, because it's negligence.
Okay. And in the situation where an employee tests positive, how do you assess whether the remaining employees are at risk or not?
Okay, so the compliance officer, the COVID compliance officer, management, and the health practitioner will obviously chat. They will disinfect the entire workplace. And then, according to the consolidated OHS directive, it was published now on the 4th of June, in there it talks about the high risk and the low risk. So if the person is a low risk, you can return back to the workplace if you've been exposed, provided you wear your mask and you have the symptom screening for the next 7 to 10 days to make sure that you don't, come up with the symptoms. If you're a high risk, like I mentioned before, you're going to have to take special precautions with somebody who has hypertension, who's severely obese, all the different chronic conditions for a vulnerable employee. And those ones you're going to have to try and ensure that they probably work from home if possible. Okay. Or you will claim from UIF for the quarantine illness benefit.
Okay. And what rights do you have if you test positive?
Okay, that's a good one, because the OHS directive said, please do not discriminate the people because they test positive. So we have rights in terms of the Employment Equity Act that you cannot discriminate that person just because they test positive for COVID. So I think we all have to be quite sensitive to the matter. We need to sometimes treat it on a confidential basis, and make sure that we don't isolate that person. I know you take them to an isolation room, but what I'm trying to get at is respect that person. Okay. We have to be human and save lives.
Yeah. That wraps up all of my questions. Thank you for your time, everybody. We hope we enjoyed the presentation. If you do have any questions, Trish's email is trish@thinkbusiness.co.za.
Thank you, Kim.
Pleasure.
Okay, Sam, we'll pass it over to you.
No problem. Thanks. Thanks, ladies. That was really, really informative in the sense of what's required in the workplace to keep our customers safe. It's also very opening when it comes to, as an eye-opener, to what's actually being provided out there, because not many companies are compliant, but the majority are trying to be compliant. The workplace plan that is supposed to be implemented needs to be actioned and made sure that it is there as part of that risk assessment. And then also, like, taking those protocols to heart. Trish, you mentioned that it's going to be in part of saving lives at the end of the day. This goes for any business, including educational aspects, because we all have kids at school, most of us do. So when it comes to desanitizing or stripping, the premises, those costs are so large for having a company come in to desanitize after a case of COVID. And within 1 week, I know of like 2 places that have spent over 100,000 Rand on one sanitization to clean it up. So that's a lot of money, for a whole place to be sorted out. But I mean, we're talking matters, of kids, or it could be, just large companies of more than 500 people. That is a lot to take into consideration. So your time spent on this to show us how we can all be safe as customers as well has been really well received. Thank you, guys.
Okay, I know that Les asked a question. Yes. Okay, sorry.
Trish, thank you very much.
Pleasure.
In the chamber, obviously, because of the work that we do and who we represent, we get quite a lot of employers who are saying, how do I get my workers to come back to work? Sometimes they just indicate that they don't feel the workplace is safe, or they say that they're showing symptoms, but one is never sure whether they do show symptoms because they don't go and have a test. Is there some advice as to how do you actually respond to an employee that doesn't want to come to work, simply put?
Okay, if you are complying with the health and safety protocols, there is nothing to stop them from coming back to work. If they decide that they would prefer to be on a no work, no pay policy, that is where they're going to have to claim from UIF. And I don't think UIF is going to entertain that unless they can prove that there's a breach in terms of the health and safety regulations. Because the OHS directive, I hope I'm answering your question properly, says that the onus is on the employer to make sure that the workplace is, obviously in terms of their health and safety policy, is safe. But if they've been exposed to somebody who tested positive in the workplace, you can get them to return back to the workplace, provided you make sure they wear their masks, you do the social distancing, and you obviously sanitize and frequently, wipe down the work surfaces and that. So I think it might get to the stage, if they can't produce any evidence to prove that the workplace is not safe, then you may possibly have to, that could fall on the line of absenteeism, because they'd have to prove, and how are they going to prove that the workplace is unsafe when you've got all these procedures and steps in place? Does that answer your question, Les?
I'm happy, but I don't think the employees are happy, because, like I said, is that very clearly one of the indicators is that some people, especially those that are getting benefits, some people actually are quite enjoying the stay-at-home principle.
I know, it's quite interesting, but if they had to claim the self-quarantine isolation UIF illness benefit, you can only claim that for, say, 14 days. Obviously, it's going to change now because the laws change from 14 to 10 days. If you want to extend that period, you actually have to provide the UIF with a medical certificate. So they are starting to clamp down to say they can't treat this as a holiday. It's not a holiday. That's why a lot of my clients are saying it's normal sick leave. Provide the proof that you are sick from a doctor or a clinic or whatever they use in the workplace, and then we will allocate it to sick leave. Otherwise, it could be no work, no pay.
Wow.
Okay, any other questions?
Yeah, perhaps. Thank you, Patricia. That was very interesting. More a comment than questions. I listened to your protocol outlay very carefully, and I'm pleased to see that we covered every single one of them. During the 5-week lockdown, we had no one working here. We had to get special permit to come in to do some maintenance. And during May, we were allowed 50% of our staff. We have a good order book, and we worked 6 days a week by alternating staff, so everybody has a chance to earn some money. During the 5-week complete lockdown, we paid everybody 3 days a week so that they would have some sustenance, and with the agreement that they would work their time back. So during the 50% not allowed, we alternated staff for them to earn money. And we've also offered our staff, especially the admin, the salaried staff, an opportunity to work back the time over a 2-year period. In other words, if they took time off, they would use their leave pay or their leave to do this. We also belong to NARCAM, which is the automotive component industry. And the protocol that flowed from being a member there, they've got a huge WhatsApp group. That information was incredibly informative. And that's where we got all our protocol from. And we went overboard. We have something like, I think, 13 or 14 hand sanitizing stations. We have a sanitizing foot pad that you walk over as you come into the factory, because a lot of the stuff, a lot of the taxis that these chaps use are contaminated, and this helps. We bought washable masks for every single one of our staff. In the morning when they come to work, they drop a dirty mask into a bin, take up a clean mask, and we even had to buy a washing machine so we could wash and disinfect all the masks on a daily basis. And yet, out of our small staff of around 50 or so factory staff, we've had 3 positive cases, which we've dealt with exactly according to protocol. And now all 3 of them have survived, and they're in good order. We haven't had anybody take any time off work unnecessarily, but because of the threat that you may have mentioned. Some people would obviously take advantage of that. But our staff have been good to us because I think we've been good to them.
And I think, Gordon, it's because you've communicated well with your staff, and thank you for that. I think you're one of those star employers there. Well done for that.
Thank you.
I see Colin Beard actually came online. now. I don't know if Colin would like to maybe make a comment about how to keep your customers safe. Colin, are you able to make a comment?
Hi, sorry, Sam. I've been on the expo. I've only just come on now. I'd like to try and catch up. Can you guys possibly send us a copy of this?
Yes.
That'll be awesome.
Yeah, no, that's fine. We'll share all the notes that Trish did with Kim today. There is a recording of this as well.
Thank you very much. I appreciate it.
No problem. Yeah. Guys, I know that time is precious as well, and business must get back to work in the real world. So Virtual Expo is waiting for a lot of us. As Colin mentioned, we're all on there, and running through with our daily day tasks. Let's get cracking, and thanks again, ladies, for being a part of our adventure today. We really appreciate it. Just so that everybody knows, next week we have there's a doctor actually coming on board from Queenstown. She's going to be talking about wellness and how to be in part of being well in the general aspect of COVID. Her name is Dr. Justini, and she is a neuropathic doctor, so she's going to be quite well informed on the wellness avenue. All right, so we really do appreciate it.
Thank you.
So yeah, we look forward to hearing from you or seeing you next week. Next week, Thursday, same time, same place. All right, then.
Thank you, Trish.
Thank you. Thanks so much.
Thanks,
Thanks for the opportunity. Thanks. Bye.
Cheers.
Bye.
Cheers.
Bye.